Hello and welcome to another episode of the Morning Brew. We're live on NTN coming to you from the GIS studios at Uranora House. We'd like to thank you so much for tuning in. My name is Jessie Leonce. Today is Thursday, the 22nd of October. And as anticipated, St. Lucia records an additional case of COVID-19. We're at case number 39. We'll get into the details of that in just a moment. But of course, warm greetings to you wherever you are watching the Morning Brew, making this your morning program for today. I'd like to say a special morning to residents here in St. Lucia, St. Lucians living in the diaspora, keeping abreast as to what's happening in their homeland, and well-wishers globally who continue to look at what is happening in St. Lucia. We so far have been in the enviable position when it comes to COVID-19 and the management of the pandemic, being able to reopen our doors much sooner than other countries who were still grappling with dealing with community cases, imported cases. And at this point in time, as anticipated, as I mentioned earlier, we have additional cases this week. Concerns over community spread, and we'll be hearing from the CMO in just a moment as to where St. Lucia is at with respect to that. We hope you are doing your part in adhering to the protocols as we go about our daily lives. Wearing of the masks, we're doing it, and now especially we're doing it in studio, even if there's no one with me or no one in with a host. We're just doing it to ensure that the practice is something that is adopted by everyone. If you see it enough around you, then you will begin to do it yourself if you've not yet complied. The use of hand sanitizer, the frequent washing of hands with soap and water, adhering to the 6-foot distance. All of these things are important in mitigating the transmission risks here in St. Lucia. So we're going to get into the details of this latest case and where St. Lucia is at, a status report overall on our COVID situation from the CMO in just a moment. St. Lucia, the Prime Minister, Honorable Alan Chasney, lobbies the World Bank for better access to finance for small states. We've been talking about this for some time. We have Lisa Joseph giving us a comprehensive report on that event. And the Ministry of Equity and Social Justice joins forces for the comfort of elderly Dengue resident. Also, we have the Culture Minister, Senator Fortuna Bell Rose. She's speaking on the importance of celebrating Jeune Creole right here, right in your homes. This year, the theme for Jeune Creole and Creole Heritage Month activity is Jeune Creole à la caille. So we do hope that you are as you're making your preparations, you're keeping in mind to keep your celebrations and the festivities as we go into the Jeune Creole weekend. Keep it limited to your family. Keep it within your family. She will be speaking on how it still is in the spirit of what Jeune Creole is all about. We're not having mass crowd events, national events physically, but we're doing it virtually. So stay tuned for that. It's coming up in just a moment. We would like to make an appeal to persons to comply and to assist the Ministry of Health and Wellness as they come into your communities. They continue to enter the communities with their education, their health education, and doing assessments and clinic work to find out what is happening, the extent of the virus in the various communities that have so far been affected. We're due for a break. When we come back, we get into the meat of things, the lead stories coming out of the government of St. Lucia. Stay with us.
Cette lisi ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique là fait wolo parler en place publique qu'on bon mais base ti boutique changer distance sociale 6 pieds Rodionalot, I ka travay tan, si ou santi ko pa cordial, quarantine ko, pas twe en contact epi lot, en ka ou te twape exposé. Si an ekouye, free 11 ou ben n'importe clinique yo pou yo. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous toutes servi Jidla à toutes les.
Together let us win this war. Say to shall be a soldier. Together we can beat this corona.
With us, if you're just joining, a special good morning to you. This is the Morning Brew. We're live on NTN, bringing you the latest developments from the government of St. Lucia. The island records another case of COVID-19. We're now at case number 39. Just want to go to a clip from the Chief Medical Officer, Dr. Sharon Belmar-George, giving us a status update on that particular case, as well as where we're at overall in St. Lucia with respect to this virus.
The Ministry of Health and Wellness received confirmation today, Wednesday, October 21st, 2020, of another case of COVID-19. This is an additional case for the day, bringing the total number of confirmed cases to 39. The individual is a 38-year-old male from the Dengue region. He was tested during a community testing exercise conducted this week. He has no history of travel or known contact with anyone diagnosed with the virus. Upon receiving the diagnosis earlier this afternoon, arrangements were made for his transfer to the respiratory hospital for care. To date, there's a total of 12 active cases of COVID-19 in isolation at the respiratory hospital. This is the largest number of cases in care at once since the start of the national epidemic. It should also be noted that all of the patients are doing well and none of them are in need of critical care. There has been a significant increase in the number of cases diagnosed over the past 2 weeks, and the ministry anticipates additional cases will be identified as the contact tracing process continues.
And that was the Chief Medical Officer, Dr. Sharon Belmar-George, telling us that there's a total of 12 active cases of COVID-19 at this point, the largest that we've ever seen in St. Lucia in isolation at the respiratory hospital. And so this is something that we need to be mindful of. There's not any need to panic or anything, but it's something we need to be mindful of and be vigilant as we go about our daily business. There is absolutely the concern for community spread, as we've been noting cases, and the link that has been acknowledged by public health officials. And so as you're going about your day, we hope that you are adhering to the protocols, because you don't know who is who have and who don't, right? We do have an important person, I like to say, in studio with us. She'll be speaking to us in just a moment about this very thing, as well as some dengue, in giving us some dengue information and just reminding us of some tips that we could use in order to protect our household from contracting the dengue virus. Her name is Naomi Grandison, and if you know about the Morning Brew, you know that she's a usual here. So that's coming up in just a moment. In the meantime, we have a story from Lucia Joseph on the governor's meeting with managing directors of both the IMF and the World Bank that is scheduled to be held. Our Prime Minister, Honorable Alan Chasney, is scheduled to participate in the virtual roundtable. The discussion is on SIDS access to finance under the theme of identifying solutions for resilient COVID-19 recovery. It is a critical meeting for small states as they face dire economic fallout from the pandemic. Here is Lucia Joseph with a comprehensive look at some of the contending issues.
Prime Minister Honorable Alan Chasney has long been an advocate for better lending policies to be applied to small island developing states by international financial institutions. As the COVID-19 pandemic takes hold of economies worldwide, small states like St. Lucia are finding it increasingly difficult to avoid economic collapse. Prime Minister Chasney describes it as war on two fronts, health and economics. According to the World Bank's semi-annual report titled The Cost of Staying Healthy, The economies of the region are suffering from lower foreign demand, increased economic uncertainty, a collapse of tourism, and the consequences of months under lockdown to try to contain the spread of the disease. With the pandemic expected to continue for an extended period, healthcare systems should consider reforms to improve effectiveness and reduce the cost borne by governments and individuals. In addition, governments will need to find paths back to fiscal consolidation after this necessary period of high spending on economic stimulus and emergency social transfers. Despite this recognition, Caribbean countries who may have been looking toward debt forgiveness as a means of economic relief have been dealt a devastating blow. World Bank chief economist for Latin America and the Caribbean, Martin Rama, says countries in the Caribbean should not count on getting any debt relief and should therefore look seriously at other alternatives of effectively managing and growing their economies. Barbados' Prime Minister, Honorable Mia Mottley, has been lobbying for debt forgiveness for Caribbean countries that are on the brink due to the pandemic. Barbados' debt to GDP ratio had been reduced in June this year to 124.7% from 175%, making the country the fourth most indebted nation behind Japan, Greece, and Sudan. But Rama contends that many of the Caribbean countries are among the richest in the region. They tended not to fall within the low-income bracket and tend not to have very high debt as other economies do. So it would be more difficult to make a case for debt forgiveness or debt reduction. Prime Minister Chasney disagrees.
That to use per capita GDP, to use debt per GDP is unreasonable because in average it's fine, but in absolute terms, meaning if you multiply that ratio by the population, it's an insignificant amount of money. And we've been arguing to use what we call a vulnerability index. And sadly, that vulnerability index was established in 1989 by the Commonwealth Secretariat. So this is really just, we're certainly not going to take this lying down, but it just tells you in the midst of all of these problems that a statement like that can come out, that we can't take anything for granted. And you would think that the evidence speaks for itself, but to change that global architecture, economic architecture, is difficult.
At the same time, Caribbean countries have been told by the World Bank to contain costs from COVID-19 while awaiting a vaccine. The advice is for countries to spend, in the first instance, on health programs, on social programs, and on education. A critical step for countries is to reopen schools. Looking longer term, the World Bank says infrastructure is a very important part of a country's growth.
The managing director, Kristalina, came out early and said government should spend as much as they possibly can and keep the receipts. Then we're told that invest in capital investment projects because getting roads going and getting other construction going helps now augment the social stabilization program. So instead of just literally handing persons income support, it's actually putting them back to work. And so at the end of the day, there's actually some physical investment into the country as well. So it's a win-win situation. And you have the real situation that globally the world has remained shut down. So most of the small island developing states of the world are tourism dependent.
But the struggle remains building confidence in global travel. St. Lucia's Prime Minister has been relentless in his lobby for pre-testing as a safe route to rebuilding the travel sector.
IATA, American, United, all over the world, people are now embracing that idea, and I'm very proud of that. That idea came from St. Lucia, has been embraced by our colleagues in the Caribbean, and we've been out there agitating to make that happen.
The efforts are yielding further results, with the UK government last week announcing the establishment of a task force to look at the introduction of testing at Heathrow Airport. From the Government Information Service, Lisa Joseph reporting.
Thank you, Lisa, for that report. Youth workers attached to the Ministry of Youth Development and Sports have presented their quarterly updates to the ministry. We have Ryan O'Brien from the ministry's information unit giving a rundown.
Youth workers attached to the Ministry of Youth Development and Sports delivered their latest reports to the Ministry on Thursday, October 15, 2020, covering the previous quarter of their activities.
There were only 8, I think.
Director of Youth, Mary Wilfred, commended the youth workers for their efforts in the field to date and urged them to continue striving for excellence.
At every quarter, we do a reporting session so that youth workers can come in to account for the work that they're doing and for us to share best practices, for us to encourage one another, for us to learn lessons that we don't have to replicate. And so this is a usual meeting for us in the youth department.
Also present was Permanent Secretary in the Ministry of Youth Development and Sports, Caroline Eugene.
I am so much looking forward to hearing from you all the good stuff I know that you are doing, because constantly I speak with Miss Mary and she always tells me of all the good work that is being done with every one of you around the island. This morning I join you to listen to what you've done. And I'm sure more or less you might highlight some of the challenges that you encounter. Listening to the challenges might put me and the rest of the team in a better position to see how we can alleviate some of the problems that you encounter as you're in the field.
The Ministry of Youth Development and Sports made a fundamental shift to provide more in-depth focus on youth work in January 2017. Youth work fosters the ability to critically evaluate one's own individual situation in relation to others and society by applying a variety of planned practical measures aimed at ensuring the emotional, social, ethical, intellectual, and physical development of young people in a caring and secure environment. So far, 20 youth workers are enrolled in the program. From the Ministry of Youth Development and Sports, I'm Ryan O'Brien.
Thanks for that. And finally, we have a report on the Jeune Creole situation, as by this time, I hope you would be aware that our Jeune Creole festivities in St. Lucia will be limited to the family unit. And we have the Culture Minister, Senator Fortuna Belrose, speaking on this, stating that it is in keeping with the spirit of Jeune Creole and Creole Heritage Month, tapping into the cornerstone of society, which is the family. So take a look at this report.
The pandemic has impacted the way cultures all over the world observe customs that draw mass crowds. Disconcerting yet necessary postponements and cancellations of traditional events are being made to mitigate COVID-19 transmission risks. Fortunately, organizers of Creole Heritage Month here in St. Lucia have found a way to observe the 2020 celebrations in adherence to national protocols by targeting the cornerstone of society, the family unit. Jeune Creole Lakainu is this year's event theme, encouraging residents in St. Lucia to celebrate with their relatives. Minister in the Ministry of Culture and Creative Industries, Senator Fortuna Belrose, says this approach is not only COVID conscious, but is fundamental to Creole heritage promotion.
If you know the history of Jeune Creole, when it was initially designed and thought of by the Folk Research Center, what the plan was always to reach the point where families embrace this, and the true spirit of community came through. And I think what we're seeing this year with the advent of COVID and the build-up over the years is a design, to make that happen. So this year, hopefully, we will see lots of families gathering and participating, but keeping it within families.
Officials are not opposed to a family from multiple households celebrating together once they observe the protocols. Since the island registered an increase in local cases of COVID-19, the protocols have been reviewed. Mass crowd events have been reduced from 500 to 100 persons.
I expect families to invite each other to come to their homes, but I think we must be mindful of the protocols with respect to the COVID. We encourage people to ensure that they have below 100 persons in their activities. That is the rule. Our police will also be very vigilant on that day, we've been told, in terms of ensuring that there are no mass gatherings beyond 100 people. But the focus, like we say, we want you to encourage and to push, is that we celebrate within our community, within our families. So it is not unusual for a family to move from Soufrière to Vieux-Fort to Dennery to go and celebrate with their family, but we want them to keep it within the family and maintain the numbers.
Complementing the family-sized Jeune Creole celebrations, Creole Heritage Month organizers are now also rolling out a slate of virtual events and activities to promote Creole heritage in St. Lucia. For the Government Information Service, I am Jessie Leonce reporting.
And finally, my glasses are fogging up from the mask wearing. The Ministry of Equity, Social Justice, Local Government and Empowerment through the Department of Human Services has assisted with the construction of a house for an elderly Dennery resident, Mr. Gilton Joseph. We have a contractor, an individual who is displaying, corporate social responsibility, Mr. Collins Lynch, volunteering to build the structure. His company, Triple L, provided the materials and the labor.
Projects like that, more people need to get involved with, because just going around the community, have so many people who need that help, and I understand what is happening, and I'm going to do my best. Once I can, I will. Like I say, in the past, I probably do maybe 15 or 20 of these projects in the last 10 years around the valley, Dennery already. So that, I'm hoping I can get the strength and help from God to continue to do this.
On behalf of the Ministry of Equity, particularly Division of Human Services, Elder Care Unit, we would like to say thank you for doing this beautiful project for Mr. Gilton. We're very grateful. We're happy he's comfortable, and we're actually saving one older person to be comfortable for the rest of the years. So we appreciate you, we appreciate your guys, your company, and we thank you very much.
I would like to say thank you to Mr. Lynch for the great work he did, because Mr. Joseph was living in a deplorable condition, and he came on board, he assisted us, and we are thankful for what he did.
And that report there, that piece together on the home being built for the Dennery resident, elderly Dennery resident, Mr. Gilton Joseph. At this point in time, we're going to take a break. These have been the latest updates from the government of St. Lucia, the various ministries. When we come back, we speak to Ms. Naomi Grandison, family life educator at the Bureau of Health Education. We're talking COVID-19, the latest cases, what they mean, what the emergence of these cases mean for our population at this time. And we're also going to be talking about dengue. Stay with us.
What does coronavirus have in common with love? Both are highly contagious. Spread love, not the virus. Like you, COVID-19 loves a lime. Beach, river, or fed. Coronavirus is like these people who track every lime just to invade. The best way to put off invaders? Cancel the lime. Spread love, not the virus. Keep you and your crew corona-free. Live to lime another day.
Together let us win this war. Said we shall be a soldier. Together we can beat this corona.
Thank you so much for staying with us. This is the Morning Brew. We're live on NTN this morning, today, Thursday, the 22nd of October. The month is going by rather quickly. We're in studio with Miss Naomi Grandison, and she is the family life educator, no stranger to the Morning Brew set. Family life educator from the Bureau of Health Education, here to speak to us on the latest COVID-19 cases, as well as giving us an overview of dengue. This is also a situation we're dealing with in St. Lucia. The outbreak has claimed lives so far, and we're keeping a close eye as well on the dengue situation. Good morning, Naomi.
Good morning, Jessie. Good morning, viewers. Always happy to be here in the Morning Brew.
Absolutely. We have the latest cases. Thank you so much for being here, by the way. We appreciate it. We have the latest cases of COVID-19 here in St. Lucia, and by all indication, we're dealing with a community spread of this virus. Just speak to us about what are the implications for these latest cases. We know the last case, number 39, has no link. By what officials can see, no link to the previous cases. What does this mean for, our level of risk here in St. Lucia? And also the previous cases, cases 29 to 38, what concerns are our health officials having right now, and what should the public be aware of?
Well, we really want persons to really rethink the way they look at this pandemic, because prior to that, everything seemed to be nice and rosy, I heard a lot of people saying we were COVID-free. The better statement would have been to say our risk is low or there is no evidence. Look at how quickly it has changed, and it's not only in St. Lucia, but all over the world. Look at France, look at various countries in Europe. What we do want to say, we continue to get additional information about how contagious and infectious COVID-19 is. And if you are to have a case where at this point, due to contact tracing, we cannot identify the link, this means that every person that you come in contact with is a potential person with COVID-19. And therefore, apart from your family members, which you've already been close to, or somebody who's given care within your community, who's at your home and stuff like that, you need to maintain the protocols. And the protocols are not to imprison you. You understand? The protocols are there to protect you. And not because we haven't had a death. Why do we need bleak news for us to try to prevent a catastrophe? So we're encouraging persons to recognize, for one, Jesse, listen to this. Apart from the sneezing and the coughing, even breathing out, somebody who has COVID-19 and they're breathing out long enough in an environment, some research has indicated that these particles can linger in the air for almost 8 minutes. So hence the reason why we are asking persons to cover up your nose too when you wear the mask. The mask is not just for your mouth. I think some people understand the speaking part. It's not just the coughing. Persons get the speaking part because, the particles are larger. Even if you speak, some persons, the spit comes out. But we need to consider the breathing aspect too. And the amount of the virus that you are exposed to puts you more at risk. When the virus enters through the nose, the mouth, or the eyes, it loves the lungs. And this is where it gets its energy to multiply. And this is how the virus will spread, because you give it an opportunity to multiply. If another person gets infected, it's growing. So less people get infected, less chance for the virus to stick around. And the other thing we want people to know is if you get infected and you have been to all blocos, you have not been maintaining social distancing reasonably, you are very close to a number of people everywhere, everybody you see in town, you're not keeping your distance, you're not wearing your mask when you go out in public, then can you imagine the rigors of contact tracing? Can you imagine how many people that will have to be quarantined?
Be an effort in futility after a while.
Yeah, and it could cause a serious economic downturn, because that's why we say stick to your family or anybody who's caring for you or close persons. Stick to them, because then it will be easier. If quarantine would mean you potentially exposed to a virus, and we're asking you to self-isolate at the moment. So we're asking persons to please wear your mask, and not just wear it, but wear it properly. Cover your nose, cover your mouth, ensure that it fits snugly, and don't touch the front of your mask as a regular thing. If you do, wash or sanitize your hands, and don't just drop your mask all over the place, on the chair, on the desk. And please wash your mask every day, your cloth mask, and the surgical mask, dispose of it. Right now, with viral indication, we are going to get more cases. The risk is higher. Wash your mask at the end of the day. Have a bag that you can put your mask in when you take it out, when you're out of the public.
Okay. And, recently the Prime Minister and CMO, they did have to speak or respond to the view, the opinions out there that this situation that we're dealing with is, not real. It's more exaggerated, or it is a hoax,
right,
or it is a quote-unquote scamdemic. Can you respond to that, how persons have been labeling the situation, where globally we're seeing deaths, persons succumbing to this viral infection. And right here in St. Lucia, people confronted with it. Thankfully, we've had no deaths here, though.
Yeah, it's very risky to believe these types of things. Furthermore, it's interesting that we do not think diabetes is a hoax, that cancer is a hoax, HIV is a hoax. We didn't even think Ebola was a hoax. We didn't think SARS was a hoax, but for some reason, a particular virus which has spread to the entire world, where all health professionals, researchers, lab persons have to deal with and test for, somehow it's considered to be unreal or hoax. Now ask yourself that question. Really think about that. Does that really make logical sense? That some people also have the thing that, okay, we don't have a large number of people dying. Not because we don't have deaths in St. Lucia, that means we need not be concerned. It's not just about the death, it's the burden on the economic system and the healthcare system. And even if you have 2 or 3% of people dying of COVID-19, look at the numbers in the world. Look at how many people are still dying. And not only that, look at the amount of people who have had to get critical care, elderly people who have been contracting the disease. I actually met a lady who told me she was away and she had it and she recovered and everything. And she indicated to me that she doesn't want anybody to have that experience. Some people would get it and they have no symptoms. They fare well, but there are a lot of people who get it and they suffer, and they can spread it to other people, and it can cause not just death but suffering. So we want to encourage persons that it is real, and we have to follow the guidance of WHO, PAHO. There are protocols in place. No matter what you say out there or you think out there, persons will still go into quarantine. The laws will still have to be enacted. So we just need to do our best to take the precaution.
We're seeing lately, I'm going to digress a little bit. We've been seeing lately on social media this great support being thrown of late behind the Chief Medical Officer, Dr. Sharon Vilmar-George. And she has been, since day one, she has been the face of every COVID-19 update to the nation. We've seen her in, it looks as if she's about to, wear out her wardrobe, every day, every couple of days, or every week, coming out with a new outfit and still a fresh face and her hair well done, and being able to continue to do the work with so much professionalism, to the nation. And of late, we're seeing this hashtag best CMO ever.
Nice.
I'm curious to know, what are the feelings of the personnel at the Ministry of Health with respect to this latest show of support to the Chief Medical Officer?
Well, for me, I know within our department, we speak very highly of the CMO, and we're very motivated by her passion and her professionalism, and more so her dedication to high quality communication. As soon as we have a case, she's on it. You know, the press release is being prepared, the communications unit is on it. It doesn't matter if it's Monday, Tuesday, Saturday, or Sunday. And so we feel very blessed to have a CMO who's willing to be on the ball or on the beat for the well-being of the nation, and of course, most importantly, to give the information and to constantly remind persons, because I think that has been a key thing in helping persons to listen and follow the protocol. For the most part, most people are doing their part. Given we have our human tendencies, most people have transformed, most people have changed, they're wearing a mask. I see the elderly out there. Yesterday we did a presentation to some elderly persons, and they were so into it, they were listening, they were receptive, they fixed their mask. So people are out there doing, but there are a few, and it only takes one person to think that they could do what they want to cause that domino effect. So the CMO has been constantly keeping those updates and doing her part. And I just want to say a heartfelt thank you from my heart, and also on behalf of the department. I can't speak to the entire, you understand, but I'm sure that they're very proud indeed.
Okay.
Great example for us all.
The views of the Bureau in terms of the interventions being made in public transport, because we saw case number 29 was a minibus operator, and thereafter the NCOPT and the different associations made decisions in one way or another to improve the level of surveillance, improve the level of, ensuring that persons are adhering to the protocols when they board the buses, the limiting to reverting to the 10 individuals per bus. What are the views of the Bureau of Health Education on this move by the minibus operators in St. Lucia? We saw long lines, much to the inconvenience of commuters.
Right. Well, I think I would say that the Ministry of Health, through the CMO, would be the main persons having the guidance and the view on that, and our department will follow suit or engage or make contributions as it relates to that. What I would say is that the protocols have been there, and the Ministry of Health has never shifted once on its recommendation for the amount of people that need to be on the bus. If you look carefully, they have always maintained the amount of persons, the social distancing, the 10 persons. So even if the bus drivers were agitating, understandably so, economically and whatever, it has been there. So we just want to employ people to continue, those drivers who are doing their part, to continue doing what they can with the sanitizing and the social distancing on the bus, maintaining and encouraging the passengers to wear the mask and to wear them properly. And the other persons, wow, I did hear one of the ministers speak to the severity of the bus drivers not following the protocol. So I just want to say to them.
But of late they have been complying.
Yeah, a lot. But there have been a couple.
Little to no profit.
Yeah, there have been a couple. That's why I wanted to say thank you to those who have stepped it up. I mean, I want to say thank you to our people. We often speak about the ones who don't comply, but the few who don't comply, please, I understand it is hard, but let's not make it harder. The first case we got recently was a bus driver. Can you imagine what could come out of that? There's still so much time, so many tests to be done, so many test results we are waiting for.
The full extent of it.
Yeah, we have not seen the full extent of it.
Yeah. I'm seeing here that there's been the reopening of more respiratory clinics, the Dengue Hospital and the Grosley Poly Clinic.
Well, on the Saturday.
On the Saturday.
Yeah.
Okay. Just tell us, is it to accommodate the increased volume of persons?
Yeah, definitely. As far as I'm aware, I'm thinking that it has a lot to do with having more times where people can come in on the weekend. You understand? So that would be helpful to the testing aspect and helping us to bring in persons who are symptomatic or have concerns about potential exposure to persons who have COVID-19.
Okay. And now we shift gears. Any final words on COVID?
Well, we keep and we will continue to remind persons that it only takes one person to not follow the protocol and be very laid back and cause a ripple domino effect. So please do your part to protect your family and the entire nation and our pockets.
Absolutely.
Yeah.
And we shift gears to dengue, the dengue virus. I mean, we've been fortunate enough to have no cases from COVID.
Right.
But we have been confronted with individuals having succumbed to the dengue virus here in St. Lucia. And it's an annual thing. We have persons
It's endemic.
Yes,
Yeah.
it happens every year around this time.
Right.
But just speak to persons being vigilant, just reminding persons, because sometimes, you're dealing with, a frequent population of mosquitoes in your home, and you very well may be facilitating the incubation in the back of your home in a drum,
Right.
If you could just speak to that aspect, tips on how persons can, ensure that their surroundings are clean enough to not facilitate that, and also give us a status update on our dengue situation right now.
Well, I want to link it a little bit to COVID-19, and this is just me trying to connect dots. I think perhaps with the despondency and a lot of the feelings people have had due to the impact of the pandemic, some people may feel like it's a lot to go out around their houses or to deal with their neighbors who have this stagnant water lying all over the place, or they may feel like, oh, we've already gotten the dengue, my son got it already, I got it already. They may feel like defeated in a sense, like everywhere you turn is mosquitoes anyway. Some people might have that perception. I mean, going out, I know I've heard it when I was out in the community. I've heard a few persons, not a lot, but a few persons say, what can you do? You do what you can on your neighbor or whatever, and this and that and whatever. We just want persons to remember that it is not just getting it is how much you're exposed to it. And there are practical things that can be done, including contacting environmental health, although they're quite under pressure, that you can do to protect yourself and your family. Why? Because there is not just one serotype of dengue. We have 4. So let's just take into consideration that somebody has gotten type 1, they can get type 2, then they can get type 3. I mean, dengue is a serious problem worldwide in the tropics. And we have a situation where persons, we need to step up at least twice a week, go around our house and in our homes. Let's look at the dish drainer. Let's look at the flower pots. Let's look at toilets that are not being used. Let's look at around the house, the drainage system. Let's look at leaves accumulating. Let's look at the saucers and these drums that persons have uncovered. I mean, it's really a bother. Can you imagine how many mosquitoes can breed in these large drums that we leave uncovered? We need to get some mesh and cover it up. The mesh would be the best solution to cover it up. And if you do notice some larvae in the water, you don't only need to throw the water away, you need to scrub the entire drum, because the eggs can stay there. And when it fills back up with water, or you fill it back up with water, they go ahead and they hatch. And then the situation goes on and on. And some persons say, oh, we need to be doing the fogging more. But that's just killing the adult. We need to nip it in the bud at the root, which is the breeding sites. First and foremost, you do your best where you can. And apart from that, we need to also think dawn and dusk. This is the time where the Aedes aegypti comes out the most, where most mosquitoes come out. So try to keep your doors closed, check your window screens. And most importantly, if these things are a challenge, wear long sleeve, light clothes at these hours to protect yourself, and use the repellent, because sometimes you go somewhere and you don't have control over how many mosquitoes. So it's what you wear and what you can apply to your skin that can help to protect you. The more exposed you are to the virus, the more you are at risk. And furthermore, if somebody else, because we have seen that between 5 to 14-year-olds have been, a lot of them have been getting the dengue fever. And most concerning it is that it's the 2 and 3, which dengue can cause this internal bleeding. Some persons get the jaundice, the yellowing of the eyes because it has affected the liver. So the significant symptoms would be vomiting more than 3 times, three or more times in an hour, blood in your vomit, bleeding from your gums, blood in your stool, irritability, feeling like you faint, and signs of dehydration, like the children, they may be crying, but you're not seeing any tears. You don't see any urine in the diaper. All of these things you need to watch for, because the fever is dengue fever. It is caused by a virus that is within the mosquito bites you. And if you have it at home and the mosquito bites you, with all the amount of that in you, then I'm even at risk now. I cannot get it from just touching you, but the mosquito can pass it onto you.
We have one mosquito in a room of 5 people.
Exactly. And just biting away. So just continue. Let's just continue to do our part and to be very vigilant for the symptoms and to go check it out as soon as possible, and to especially consider that if you have a condition, an underlying condition, Jessie, that's where it's even more of a pickle. Just imagine you have diabetes, cancer, and it's Cancer Awareness Month, and whatever, sickle cell, immunocompromised with sexually transmitted infections. You need to even be more careful, because there you have a virus that can affect your entire body system. And so we need to check on that. The milder symptoms would be the pain behind the eyes, the muscle aches, the joint aches, the bone aches. And of course, we're telling people Panadol and paracetamol are the same thing. Panadol and paracetamol are the same thing. Do not take ibuprofen, aspirin, Voltaren, because these can cause bleeding, and dengue can contribute to internal bleeding.
It's interesting you mentioned that, because there was someone who voiced that concern. What is paracetamol on the recent live when the CMO was stating that you can use that to get some pain relief.
Yes, usually medications would have different, like a generic name and a trade name, and some of them just have variations in their names, but pretty much they're the same active agent.
Yeah, and it's always good to keep some paracetamol with you.
All the time. You should always have it at home, in fact.
Well, definitely repellent, what is mosquito spray, the aerosol.
Yes.
Coil, I dare say.
Okay.
Some people think it works. Some people believe it works.
People try different things like the citronella, the lemongrass and stuff. We can't say that it's extremely effective, but you work with what you try, what you feel might be helpful, but you do it collectively. You do things from various angles to prevent the enemy from succeeding.
Multiple tactics.
Can you go out there and say, oh, I'm just not going to cough and sneeze out, and that will help with COVID-19? You have to do multiple things. You have to do multiple things, just the same with the Aedes aegypti. It is a very dangerous mosquito and difficult to deal with, so we need to take the bull by the horn twice a week and check for those breeding sites, wear the long clothes, insect repellent, spray the rooms.
And I know many people have become athletic using the rackets.
Right. I enjoy that, actually.
The zapping rackets.
I love when I love it.
Yeah. But we so far seen the deaths and related to the dengue fever, and I do hope everyone is, you can't eliminate the mosquito population.
Not at all.
And we're not expecting persons to do that, to kill off all the mosquitoes in their community, but doing your part to ensure that you reduce the population of mosquitoes in your area as much as possible.
And working together too, because the garbage, people just dispose of the garbage indiscriminately. They have derelict vehicles and all things that are just lying there and just collecting water.
It's a time for communities to come together. I believe there was the Banans community recently. They all came together. We had community leaders springing out of the neighborhood, sort of, to just pick up all of the refuse and all that sort of stuff, looking at receptacles that were open, to ensure from that, I think it was led by Environmental Health Department, that cleanup. So, it's a time to settle feuds, decades-long feuds.
And not wait for, I dare say, the powers that be to give a handout for us to take care of ourselves.
You're right.
It just takes a discussion, whether it be on the block or in the homes, to say, guys, so let's do something. Let's do something for the community. And you have a lot of drains that are stagnant in the community and they just need to be cleared out. I know of within the community that I stayed, a group of the guys came together and cleaned the gutters. They got their weed whackers, they got their shovels, and they dug in there. And it wasn't about whose house and where and I'm not doing there because I'm not talking to that person and all that kind of thing. So we don't need to wait on the authorities. I mean, just think about it. The authorities are stretched. So let everybody do their part to try and not just say, oh, we can't stop the mosquitoes anyway. We can do our part because it's getting worse. And a lot of people don't feel like they don't have the energy. And so sometimes we need to help them. A lot of people are elderly. They cannot do it for themselves,
Well, Naomi, thank you so much.
Get out and do your part, man.
Get out and do your part. Thank you so much for sitting in with us. Any final words as we wrap up? Our time is up.
Yes, I just want to say I love you, St. Lucia. Do have a blessed day and love yourself enough to do your part. Let's work together in the community. It's more togetherness and less, separation so that we can get somewhere for our health and well-being.
Bon fête Koyol.
Bon fête Koyol.
As we close, just want to let you know that the respiratory clinics, Denry Hospital and Grosley Polyclinic, they have been reopened. The primary healthcare unit in the Department of Health and Wellness informs the public that these clinics in the following communities will be reopened from Saturday, October 24th from 8 a.m. to 4 p.m. All persons coming to these respiratory clinics must wear a mask and adhere to the guidelines of physical distancing. Before entering the facility, each person's hands will be sanitized with an alcohol-based solution. The Ministry of Health will continue to take the necessary precautions to ensure the safety of all during the COVID-19 pandemic. So that's the latest word from the Ministry of Health in that regard. St. Lucia records, case number 39 of COVID-19. We so far have the largest number of cases in care at once at the the Respiratory Hospital. 12 individuals are there being treated. They remain active cases up to date. And we do wish them all the best and a speedy recovery from this viral infection. That's one of the lead stories for this 24-hour news cycle. We also have the public being urged to adhere to the infection prevention measures. We just had Naomi from the Bureau of Health Education indicating the community spread, the level of concern that officials have right now, and the importance of you playing your part, adhering to the protocols. We've seen city police arresting
persons for not wearing their masks.
Yeah, someone from Monday, I believe there was another arrest made, I think, for this week. So things are getting serious. The officials need to, tighten the strap on, individuals and their level of compliance in the city, especially when they're out in public. The Prime Minister, Honorable Alan Shastney, lobbies the World Bank for better access to finance for small states. We had that report from Lucia. And the Ministry of Equity and Social Justice joins forces for the comfort of an elderly Denry resident. And we had the Culture Minister, Senator Fortuna Bell Rose, making an argument for Jeune Creole being limited to the family unit, stating that it is in keeping with the spirit of Jeune Creole and Creole Heritage Month, us focusing on the cornerstone of society. It's where all good things come from. That is the family. So we do hope that as you go into your Jeune Creole weekend, that you are mindful of the protocols, that the mass crowd events have been reduced from 500 persons to 100 persons. So if your family comprises 200 individuals, you may have to rethink that and perhaps make it 2 separate family celebrations. But whatever you're doing this weekend in terms of the celebration of Jeune Creole, it's something not to be missed out on, but done in adherence to the protocols. I'd like to thank you so much. My name is Jessie Leon, signing off for now from this morning's brew for today, Thursday, the 22nd of October. Goodbye. Enjoy the rest of your day. Make it a fun one. Find something to laugh about. Find something to reminisce on. Go back into your memory. Just some good vibes, spreading out across the length and breadth of St. Lucia today. Do stay tuned for more NTN programming. We have so much more in store, so stay with us for the duration of today. Goodbye.